Welcome to this edition of the First Aid Show. Diabetic emergencies are common, and we asked a paramedic, how would you treat them?
There are two main types of diabetic emergencies. Their sugars can be high, which is a hyperglycemic event, or their sugars could be really low, which is a hypoglycemic event. Generally, if somebody is diabetic and they can speak for themselves, they will tell you what they have eaten, what medication they have taken, and they are able to suggest to you what might be happening. So if their sugars are high, it's likely that they have been unwell, highly lethargic, really thirsty, they might be sweaty or clammy, and this has happened over a period of hours or days. If their sugars are too low, you will see very distinctive behavioural changes, and they stop being able to reason with you. They might become a bit agitated. Again, they might become sweaty or clammy. And it's really important, if you know that they're diabetic, that you, whilst they can still talk and you can communicate with them, that you get their blood sugar testing kit and you try and get them to measure their sugar. A normal range for an adult is between 4 and 6. Some people might run their sugars naturally high, but if you find a reading that's lower than 4, it's really important that you encourage them to eat something that's high in energy. So spoonfuls of jam, honey on toast, anything you can to try and lift those sugar levels up. Do not let them take any more of their insulin if they inject themselves in insulin. If you're not sure if they're diabetic, you can often see a clue because they'll have bruising on their tummy or on their thigh. They might have a medical alert bracelet. The other thing to look out for are the things that you might have been seeing on social media and on adverts. They have a self-testing kit that's in their arm, and it will read to an app on their phone. So you can ask them to open their phone, or you can use their thumbprint to open their phone and look at that monitor and see where their sugars are reading. But it's really important that you get them to eat some carbohydrate before their sugars get so low that they pass out, and then it's not safe for them to swallow.